Let me ask you about the vaccination programme. A lot of people might be concerned at the disparity in the numbers here. We know from the government's own figures that you've been in receipt of more than 700,000 doses of the vaccine. But again, from your own figures from yesterday, only about 264,000, well, just over, in fact, just under 265,000 have been administered. Why is there a disparity?
The first point that I've got to make is that we are not in receipt of 700,000 doses of the vaccine, Gary.
How many then?
I'm going to explain this very carefully to you because it needs to be done. We published a vast amount of detail on the allocation of the virus to Scotland over a number of weeks hence. The United Kingdom government made it clear to us they didn't want that information circulating because it was commercially confidential, so we had to withdraw it. So my hands are rather tied in how much I can talk to you about specific numbers. But what I can say to you is that Scotland has an allocation of vaccination doses which we draw down through the supplier of the vaccine.
But that allocation is 700,000 according to the figures that you published previously at this stage.
That is correct, but we don't. But the crucial, you said to me that we have received those, Gary. We have not. We have been allocated them.
Well, what percentage of them have you received?
Well, that's where it's difficult for me to go through the specific numbers because my hands are tied by what the UK government restrictions that were imposed on us last week. What I'm saying to you is that we have taken steps to make sure that when vaccines become available, we distribute them to the health and care system around the country. And our priorities have been clear. We wanted to go through the most vulnerable first, care homes. That's a time-consuming and complex task, and we have now administered the vaccine to 95% of care home residents.
But with respect, Mr Swinney, that doesn't explain why there would be a shortage of supplies to GP surgeries. I understand it might take time to vaccinate people in care homes, but if you do have more than the 264,000 that have been administered so far, why is it not getting to the GP surgeries?
Well, there is a programme to make sure that the vaccine get to GP practices when they become available, when they come into the hands of the Scottish Government, because my key point that I've just given you in my earlier answer is that we do not have that volume of vaccine in our hands. We cannot distribute that because it's not arrived with us yet. It may have been allocated to us, and that's very, very welcome.
Do you know when you're getting it?
We'll get it over the course of the next few weeks, which is why I can confidently say to you that the commitments we have given, that the over 80s, for example, will all be vaccinated by the end of the first week in February, is a commitment that will be fulfilled.
But with respect, we seem to be dancing on the head of a pin here. You're telling us that you can't give us the figures because of the UK government's restrictions, but then those figures are wrong anyway.
No, what I'm saying to you is that the commitment we've always given, which was that over 80s would be vaccinated by the end of the first week in February, is exactly what's going to happen.
But your figure said 700,000 at this stage, but you're saying that that figure is wrong.
No, I'm not saying. Well, what I'm saying is that I'm accepting that's been allocated to us, but it's not in our hands, Gary. It's quite a simple point that I'm trying to make to you, that we've had an allocation of that volume of vaccine, but it's not yet arrived with us because it's got to go through it's got to go through the checks that are made by the principal distributor. It's then got to be physically distributed to us as a national allocation, and then it's got to be physically distributed to 1,100 locations around the country. And all of that takes time. But the crucial point of reassurance, Gary, which is the absolutely solemn reassurance I'm giving you, is that all over 80s who we said would be vaccinated by the end of the first week in February will be vaccinated by the end of the first week in February.